Late Night Health continues in a little bit. In fact, in our next segment, it's going to be the Daryl and Mark 14 minutes.
Can you stand it?
I don't
stand to wait.
I know. I can't wait. And then we'll wrap our show up with Robert Clancy from the author of The Hitchhiker's Guide to the Soul. We're talking about arthritis in the knees primarily. Is the stem cells working in other areas like shoulders and hips as well?
Yes, there's an impressive study that came out of France with a 10-year follow-up with injecting stem cells in the shoulder in conjunction with a rotator cuff repair. So when someone is in their 70s, their failure rate for a rotator cuff repair is about 40%. The reason being is as we get older, our potential for healing is not as good. We don't have that great a blood supply, and that's why the cuff tears to begin with, because the blood supply recedes and makes the area more vulnerable to injury over time. And so when we repair the cuff, which is taking tendon and sewing it back down to bone, that repair doesn't tend to heal that well and has that 40% failure rate because our blood supply isn't as good, and scar tissue mixes in with the tendon when it attaches to bone, and scar tissue is not as strong as tendon. So a study that was done out of France, they took 90 patients, divided them 45 that got stem cell therapy at the time of the surgical procedure, 45 did not, and then they followed them for 10 years. And what stem cells do when you inject them in this circumstance is they promote the growth of blood vessels, they inhibit scar tissue formation, and promote the growth of the tendon so that you theoretically, they haven't tested this, but, you have a stronger fixation and a decreased failure rate. And in their 10-year follow-up, the success rate for those people who had the stem cell injected was 87%, and then the success rate or failure rate of the people who did not have the stem cell therapy was 37%. So you have a 13% failure rate versus a 37% failure rate at 10 years. And so that's pretty impressive. And so what I'm doing is injecting them. I perform the rotator cuff repair, inject the stem cells at the same operative setting. And incidentally, these people postoperatively have a marked decrease in pain compared to the people who do not have the stem cell therapy. And they also recover very quickly with physical therapy, so people at 2 months are looking like they are at 6 months. And I caution them because I don't want to accelerate their rehab. I just want them to prevent them from having another surgery.
So they don't also have to take as much opiates.
Right, yes.
Wow. That's in itself impressive.
Yes.
So maybe stem cells could be used for pain relief.
Well, they're anti-inflammatory, so they're going to decrease that inflammation wherever you inject them. They're attracted to inflammation and injury, and then they go to those areas and do all those little things that I said, like little drugstores, and capable of doing so many things at a site of injury or inflammation.
What about, we started to talk about bone on bone, and that can be in the shoulder, knees,
yes,
and other joints. Is that too late if you have bone on bone?
So when you're bone on bone, you've gone through a course of treatment. Typically, my patient with osteoarthritis, we look at weight loss. Okay, let's try and decrease the load on your joint. And then let's look at your diet. Let's stay away from foods that are inflammatory, such as high glycemic index foods, white flour, white rice, white potatoes. Those cause inflammation and increase
You're sounding
pain.
Holistic there. That's good.
Very. I counsel all my patients on diet, particularly the ones with arthritis, because really changing your diet and losing weight can make a big difference in terms of the pain. Then we look at doing things like sodium hyaluronate, which is the lube job people hear about, a series of injections that makes the fluid inside the knee thicker so that there's less friction, and it also has anti-inflammatory properties. And then when that starts to not work, and also along the lines we're giving people oral anti-inflammatories, then we look at doing a steroid injection, which is an anti-inflammatory and can work for several months to relieve pain.
But at the same time, you can't use the stem cells when it's bone on bone. There's nothing to regrow.
I'm getting there.
Oh, okay.
So then what's your alternative when you have your steroid injection isn't working, the alternative is a joint replacement. And some people they're not ready for a joint replacement. It's bad timing. They don't like the thought of having metal and plastic in the knee because it has a finite life. Hip replacement lasts for 15 years. Knees last for 20 to 25. So then we start looking at other alternatives. If you are bone on bone, the stem cell therapy has a chance maybe to grow some cartilage. However, it's a much more powerful anti-inflammatory than a steroid injection. And studies have come out. A study was done on ex-NFL players. And a single stem cell injection, these are guys who are looking at hip replacements, 75% success rate 2 years out, where they still hadn't had a hip replacement and still were getting relief from that single stem cell injection.
That's amazing. Will you come back? Maybe bring your associate here, your colleague here in Southern California, Joanne Halbrecht, stem cells for orthopedic use. What's your website, by the way?
It's www.boulderinstitute.com.
Boulderinstitute.com if you're in that area, and people do fly in all over the place.
Yeah.
You have the surgery and Joanne will take you out on the slopes afterwards, right?
Yeah, absolutely.
Yeah, sure. All right. Hey, thanks a lot. Coming up
You're
next, the Daryl and Mark talk. Don't go away. More coming up on Late Night Health. This is Late Night Health. Join us at latenighthealth.com.